The amount of time spent getting updates on COVID-19 is strongly linked to how anxious and stressed people feel. However, the official use of WhatsApp to disseminate information appeared to reduce people's anxiety. Now, that's according to a recent study by Yale-NUS on news exposure during the pandemic. Researchers are saying that these findings are encouraging. They could empower government agencies to develop innovative communication solutions that can perhaps help people cope during this crisis. The study was conducted with 1,145 residents here in Singapore over 8 weeks in March and April this year. And for more, we're joined by lead researcher, Assistant Professor Jean Liu. Professor Liu, good evening and welcome. Good to talk to you this evening. Now, though information seeking is encouraged during a pandemic, we want more information, but the research has also shown that transparency promotes resilience. Your study found that the longer someone actually spends doing so, the poorer his or her psychological health. So why is that?
Yeah, that's a really interesting finding that research groups all over the world have been reporting. So most people spend about half an hour to 1 hour getting COVID-19 updates, but about 1 in 4 people spend 2 hours or more, and this seems to predict poor mental health. There's a couple of reasons why this could happen. First, there's a lot of COVID-19 news and rumors being shared. The World Health Organization calls this an infodemic. These are largely bad news, as you might imagine. So maybe reading about all these details makes you feel worse. On the other hand, maybe those people who are already depressed, anxious, or stressed may spend more time reading about COVID-19. So the direction could really go in both directions.
Were you surprised by the results? Are there other factors you think could have perhaps maybe contributed to what you found?
One thing that researchers picking up my paper have asked me is, do you think the citizens' trust in the government makes a difference? I think that is definitely a factor. Our primary finding is that over and above news predicting poor mental health, taking updates and predicting poor mental health, using a WhatsApp channel actually mitigates that risk. So, perhaps people's trust in the messaging makes a difference.
So, Professor Liu, let's talk a little bit more about that official WhatsApp channel, because your research found that people trusted that more than traditional news sources like, newspapers, television like us, and radio. So can you explain the psychology behind that? And what perhaps could that suggest for government agencies who might be responsible for information dissemination?
I'm speaking on Channel News Asia while I say this, but I think people still have a high level of trust in all the traditional sources. So we asked participants to rate how much they trusted each source, and radio, newspapers, TV, all these had a rating of 3 out of 4. So it's very similar to the official gov.sg WhatsApp channel. You want to compare this to online forums like Hardware Zone or Friends social media posts. On the whole, people rate this as much less trustworthy. So I think the primary gist of our finding is that people are saying that if the government makes an official statement, they're likely to trust it. But that said, the nice thing about WhatsApp is that you get the messages across very quickly and you can forward them very easily. So perhaps this is a good way to counter the onslaught of fake news that is going around.
Yeah, well, speaking of that, your report also said that it's not too clear why the use of a WhatsApp channel was linked with reduced depression symptoms. But can we have a sense of what some of these potential contributing factors are?
Yeah, we were very pleased to discover that, using an official WhatsApp channel could buffer a person from depression and anxiety after you factor how much time the person spends getting COVID-19 updates. Maybe this has to do with the infodemic again, because with so much poor information out there, getting timely and reliable updates through WhatsApp, maybe that could make a lot of difference.
Professor Liu, people like Glenda and myself, we can't not know, what's going on with COVID-19. We need those updates because we're in the news. But how can individuals perhaps balance, news consumption better during the pandemic?
Yes, that's a very tricky one to balance. For individuals, I think the take-home message of our research is that you need to look for reliable sources. And you probably should spend less than 2 hours a day getting updates, unless it's your job, of course. That's the norm of how much people spend. In terms of authorities as well, I think Singapore has done a great job overall exploring different technological platforms to communicate risk to the public. But one thing we need to keep in mind as a society is to keep on looking for those who are vulnerable. So for groups that may not have access to high quality COVID-19 information, maybe because of language barriers or technological access. So for these groups of people, we need to plug the gaps because our research is showing that this could make a difference for mental health during this pandemic.
Well, thank you so much for speaking to us and helping us understand this study. We've been speaking to Jean Liu from the Yale-NUS College.